Good afternoon, everybody. I'm Maureen Flynn, and I'm delighted to be here with you for a special QPS Talk Time from the Irish Association of Directors of Nursing and Midwifery annual conference in the beautiful Roscommon by Lough Ree. So it's my pleasure to welcome our guests today, Professor Laura Serrant and Fiona Hanrahan. So we're going to be talking all about safety, inclusion, diversity and equity. So also we'd like to connect out with the world on social media. So you'll see on the screen our X handle. The recording of this session will be available on the YouTube channel to listen back to, and we'd love to continue the conversation with you on LinkedIn. So without further ado, it's my huge pleasure to hand you over to Fiona Hanrahan, who's going to give you little snippets and insights on how our conference is progressing, and then she'll introduce Professor Serrant. Over to you, Fiona.
Thank you, Maureen. Good afternoon, everybody. We've had a really busy morning here at conference, a very rich and a very thought-provoking morning. I have a lot to think about when I finish here. So we've rushed up from the conference room. We had a full house this morning. And when a full house is silent, listening to your speakers, you know you've got a conference right. And I think that's one of the big things for me, is that there was absolute silence in the room. There was no tip-tapping on phones or shuffling around. So people were totally engaged with our speakers. So, and as it happened, you know, our speakers this morning, without knowing or speaking to each other, the themes of the four talks just was like dovetailed. It just worked so beautifully together, and people referring back and forth to each other's talks. So I thought it was really wonderful. We had our president, Eileen Crowther, spoke this morning and gave some personal insights into kindness in her own workplace and the importance of that for her. Then Dr. Ger Shaw has spoken to us and really talked about the kind of policy-driven parts of the agenda for inclusion in Ireland and where we're up to now, and gave us lots of resources actually that I didn't even know were existing. I'm going to go and look at. And then we were very fortunate, Mr. Adam Harris came to speak to us. Adam, if anyone knows him, he is autistic, and he's the founder and CEO of a charity called As I Am, who do absolutely powerful work in advocating for people, for autistic people, inclusivity in workplace and in the home. And he just gave the most powerful talk I think I've heard in a long time, from his own perspective from childhood to where the charity is now, and how they contribute to both, I suppose we were looking from a healthcare lens, of course, but it makes me think about our environment in healthcare, and not just patients, but also our staff and the needs of people who are neurodivergent. So I think there's a lot to think about there. And then we were so fortunate to have our star of the show, our keynote speaker, who I'm going to hand over to in a second now, Professor Laura Serrant. Laura is a nurse and academic, a multi-award winning leadership development and inclusive practice specialist. Her specialist consultancy focuses on leading diverse teams. Laura's clinical academic research focuses on the needs of marginalised and seldom heard communities. And I think that seldom heard, we often use the term hard to reach. So I think now I'm going to use hard to reach and seldom heard. I'm going to put them together. Laura's leadership activities are aimed at advancing healthcare scholarship and workforce wellbeing diversity. Laura is an author and has over 100 articles and books published, and is regarded as a BBC expert woman. This year, Laura was awarded a CBE, or Commander of the British Empire, by King Charles III, which is a huge recognition for services to nursing in the North East and Yorkshire. So Laura, thank you so much. You gave such an inspiring talk this morning, and I'm so happy that you're willing to share it again with our outside audience. So I'll hand over to you, and thank you so much.
Thank you very much, Fiona, and thank you for just the gift of being in this space. It's not my first time to Ireland, but it's my first time to the IADNAM conference. And I think what struck me the most is, as you said, Fiona, when you stand there on the stage and you look out, often, particularly with leaders, people are having to do other things, because it's very rare for leaders to have space to actually just consider their own development. Often they spend a lot of time developing other people. And I think the fact that we were packed to the rafters, you know, I heard that some people couldn't even get to this conference because it was fully booked, actually shows the importance of this subject, the focus of the conference around safety, inclusion, diversity and equity. Because the world is a very diverse place, and even if we don't move from where we started, the world changes around us. And I know certainly from the early presentation that we had from Dr. Shaw, she showed how the workforce in Ireland has changed, with about 40% of the workforce being internationally educated nurses. And I think that's a reflection of how the world is. You know, the gift of nursing and midwifery is that they are very portable careers. You know, everywhere in the world, people will become sick, people will die, people will be born, communities will need help and support. And so nursing and midwifery are the ideal careers to help us migrate and to move around. But the challenge that brings is then that often, even if we don't move ourselves, people come and go. We know there's a world shortage of nurses and midwives. So here in Ireland, as in other places in the world, we've had to manage and navigate that space of change, which brings us to the focus of this conference, in that as leaders in nursing and midwifery and in healthcare generally, how do we actually ensure that our leadership helps promote inclusion and belonging? And that was part of the focus of the conversation. And before I kind of talk a little bit about what we talked about this morning, I want to set a bit of the scene for you, because Ireland, as I've said recently, like other parts of the world, have seen an influx and a conscious recruitment of nurses from other countries with other cultures to basically help our systems. And in England, where I'm living and I work, I live and I work most of the time. This started right back in 1948. In 1948 was the first year in June when the NHS was established. And within a month of the NHS being established, it became very clear that there were not sufficient nurses, midwives, doctors and healthcare professionals to actually run the service. And it was anticipated that if we didn't have more people come to work within the system, within a year, the system would have collapsed. So we're now just celebrated 75 years of the NHS system in the UK. So we can say without any worry that without the influx of internationally educated and trained nurses, midwives, and other healthcare professionals to the NHS, we would not be here, it would not have survived. And we see that now still being replicated here in Ireland as in elsewhere. But there's a difference between recruiting people to do a job and enabling them to feel that they are included and they belong in the space. And that's obviously the challenge for readers. So I want to start by reading a poem that I ended the first part of my session today with. This poem I originally wrote when it was the 70th anniversary of the NHS. I didn't write it for that, but I wrote it at that time. And since then, the poem was adopted by the British government, and actually is the poem that's inscribed on the National Windrush Monument, which is in Waterloo Station in London. And the first slide, just to help you think about this while I read the poem, talks about the importance of understanding the roots and the wings that we have that enable equality, diversity and inclusion to continue. It hasn't come from nowhere. It's rooted in the healthcare system wherever we are. I know, for example, I've got a very good friend who's from St. Vincent. Now, this is extra that QPS leaders are getting that to people in the conference didn't get. This is an exclusive. A very good friend of mine who is from St. Vincent. She is a nurse, and her father is, well, he's recently died in his very late 90s. I think he was 98 or 99. Last year he passed. And he was a consultant. He was a doctor. And he did part of his training in Ireland, in County Mayo.
Did he?
And he met a lovely girl who he married and who is my who's Irish and who is my best friend's mother. So she is from St. Vincent and Irish heritage. And they went back to live, and her mother was also a nurse, and they went and lived their whole life in St. Vincent. And and he died at 99. So that tells you how long ago that was. So the roots of migration and forming and learning and sharing nursing and midwifery practice sits within Ireland very squarely. It's not just a recent thing. So we need to understand that, because that's a very valuable resource which gives us a whole range of experiences to enhance our profession. But remember, people came because we asked them to come. So the poem, You Called and We Came. You called and we came. In ships bigger than anything we had seen, dwarfing our islands and covering them in the shadows of smoke and noise. Crowded, excited voices filled the air, travelling to the motherland. Over weeks, over oceans that threatened to engulf us. Driven by a wish, a call to save, to rebuild and support efforts to establish health for all in the aftermath of war. You called and we came. Women and men of position in our homelands, nurses with a pride in the excellence of our care, with experience of management, organisation and a sense of duty. We appeared, smiling and eager to work on the wards and clinics of this England and Ireland. You called and we came. Our big hearts, skillful hands and quick minds, encased in our skins of a darker hue, which had shimmered and glowed in our sunnier climes, but now signified our difference, our unbelonging. Matrons became assistants. Nurses became like chambermaids, and all the while striving to fulfill our promise to succour, to serve, to care. You called, and we came. The blue of the sisters' uniform seemed as far away from us as the moon, unreachable by our dark hands in this cold land. But we were made of sterner stuff. The hot sun which once beat down on our ancestors when they too left their lands shone within us, forging our hearts and minds with the resistance of ebony. You called, and we came. Rising like the phoenix from the heat of rejection, we cared, we worked, and we organised, until the quickness of our brains and the excellence of our care made it hard for you to contain us. And slowly, so slowly, the blue uniforms had darker and lighter bodies beneath them. The professional care in our touch was valued, despite the strangeness of our speech and the kinks in our hair. You called, and we came. A new millennium, new hope spread across this land, new populations engaging and reflecting the varied, diverse and vibrant nature of these shores, challenging and reflecting on leadership for health, moves to melt the snow at the peak of our profession, recognising the richness of our kaleidoscope nation where compassion, courage and diversity are reflected in our presence and our contribution, not only the hopes and dreams of our ancestors. Human values needed to truly lead change and add value. Remember, you called. Remember, you called. You called. Remember, it was us who came. That poem reflects.
Thank you. Sorry, I can't let that go.
That poem reflects the experiences of nurses and midwives who came way back in 1948 and before on the Empire Windrush and other ships. And sadly, it also reflects the experiences of nurses today coming from other places. So our work as leaders cannot be underestimated in terms of creating the spaces, the opportunities where people actually feel they belong. And one of the things I talked about this morning was actually around what belonging really means. Equity, diversity, and inclusion. They're words that we use interchangeably. But how do we actually know whether what we do makes a difference? And the question is, and the answer lies in whether people feel they belong. Belonging, linked to the work again of Brené Brown and others, belonging is where you're in a situation where you have the confidence to make a mistake. That's what true belonging is. If you think about your family or people who are special, you love them, you make mistakes, you get things wrong. But when you know that you belong in a space, you know that you might get pulled up by your mistake. You might need to learn something different or enact a different response next time. But you know that people aren't waiting to catch you out. They're not going to hold your mistake against you forevermore. They're not going to believe that that one mistake you make makes you a different person. And that's what true belonging is. We've striven here in Ireland and elsewhere to increase the diversity of our workforce and profession, but diversity just means a variation of people. If we want to move from just having people there to making them feel they belong and they have an equal chance of progression, an equal chance of giving and being of their best, then we have as leaders to create spaces of belonging. So one of the questions that I asked and I talked through with everybody to reflect on is, how do you demonstrate your commitment to inclusion and equity and belonging in what you do every day? And that's a question for everybody listening here. How will they know that you are committed to equity, inclusion, and diversity in your job, in what you do every day? And the answer does not lie in your strategy or your policy. You are already an expert in your job. Otherwise, you wouldn't be a leader. Otherwise, you wouldn't be an experienced practitioner that you are. But how do you make sure that what you do every day reflects your commitment to equality, equity, and diversity? And what I shared with the team was actually thinking beyond protected characteristics. When you know someone's protected characteristics, that's the least you know about them. That's the starting point. What you do with that information is really important. How do you use that information to actually make sure they can feel included and that they belong within the space? And that again is another reflective question for you. What do you do in your everyday that helps people feel they belong? Remembering that belonging is about having the confidence that they can make a mistake. That's the easiest way to think about it. Now, one of the things that were questions that came from the members who attended the session today was, if we are a group of all white, all female, very similar people, how can we do our best around inclusion and equity and diversity? And that brings me back to my point about this is more than just protected characteristics. And there are three things that I shared today. We all start from where we are. If you are a white, middle class, Irish through and through, experienced leader, you have particular advantages that you can choose to use in order to demonstrate your commitment to equity, diversity, and inclusion. So, for example, when you are in a meeting, some things will be said or not said because you are in that meeting. You might be more likely to witness incivility around inclusion. You might be more likely to witness a lack of understanding around belonging, in a way that I personally would not, because people modify their language when I'm in the room. So your demonstration of commitment, what do you say and how do you challenge? How do you bring equality, diversity, inclusion and belonging issues into your everyday conversation when it's not on the agenda? Because what we learned today is diversity does not mean equity or inclusion. It's no guarantee of that. It's by and through the actions we do that people have an equal chance of giving the best of themselves. And the 3 points I want you to remember when you think, what could I do? Is start from where you are, use what you have, and do what you can. Because the most important thing about this is not a one and done. This is a context that will change, and it's an infinite part of our work. But all our work is infinite. As I said right at the beginning, we're not going to wake up tomorrow, unfortunately, and find nobody's sick, nobody's been born, nobody's dying, nobody's in need. We do it all the time. So doing it and including it in terms of equity and inclusion has to be part of our normal everyday. By what actions will they know my commitment? That's the question. But remember, you can do anything that you want as a leader around this, or not, but you cannot do everything.
Yeah.
So what are you going to do next? That's it.
Thank you.
Wow.
A wise choice for us all to have to make. And thank you for sharing your beautiful, beautiful poem. It made me think back to the first year I qualified, which was early 1980s. And you called and we came. I went to New York. New York called.
And you went.
And I went. And I had come from working in a uniquely Irish context to an enormous interdisciplinary team. And it really makes me resonate with how I felt then. So
Yes.
thank you for that. It was the other direction
Yes.
of working, but it equally applies to both.
Yeah. But we can all think of scenarios and situations where we move from a place of being confident and competent in what we're doing to a place where we're not. I mean, even moving into a leadership role, we talked about this morning, is a big shift. You know, 1 minute you are a confident, consciously competent nurse or midwife or practitioner in practice, then you are rewarded with a leadership role, and suddenly you're not so confident and you don't feel so competent. You are promoted out of your expertise.
Yeah. And you have to fake it till you make it.
And you fake it till you make it.
To develop a new expertise.
To develop a new expertise. But of course, what we do in those spaces is, we realise that we don't have all the answers. So we allow ourselves to be human in that space. But what the important thing is then is asking the question. And that's the real leadership trick, is knowing how to ask the question. And that's exactly the thing around equality, diversity and inclusion. We don't need to know everything about every different culture or whatever, because we have the expert in front of us.
Yes, exactly.
We just have to ask the right questions.
And empower them to answer it.
Exactly.
Yeah,
Exactly.
that's really.
I see some lovely chat in the chat box and asking for copies of the poem. So there is a link, isn't there?
There will be. One of the things that we will be sharing is the poem. Obviously, you can have the written version of it, but there has been put together a short little video thing of me reading the poem and actually some visual pictures that accompany the poem, and there's a link to that, and so I will share that so that can be shared.
Is that on your QR code?
It's not on the QR code, but I will share it so that it will be when people get me. I'll share it with you. Yes, and just to say that I'm happy for anybody to use that in order to initiate and engage a discussion or to help with kind of passing the message about what it actually.
I think where your poem resonates is, I think, because for Irish people, so many Irish people were called to America, to London. I went to London, there was no work here. So that call to help and then to be treated as other when you get there is different. And I must say, when I was in London, I was there in the 90s, and the North was you know, the troubles in the north. So often with my accent, I was treated as different.
Yes,
Even though I fitted in.
exactly.
You know, yeah.
And,
So
and that's
not a tiny way, but you know, you do feel a different.
and that's the whole thing about the protected characteristics.
That's exactly it.
Because when you walk into the room, nobody would question, but as soon as you open your mouth,
yeah.
And so we all have different ways in which we can blend in some ways, but actually some.
And I think in you know, you look across the room who's there today, you'll find a lot of people in that room today would have spent time in the UK or Australia, because a lot of us of a certain era qualified when there was very little work in Ireland, and so there was almost a force to go overseas.
Yes.
So I think that's why people were so focused on you today, because actually it made so much sense, and your poem just to me resonates with a lot of stuff that we think about, but now it's our responsibility to change that narrative.
And I think sometimes when we move beyond an experience, sometimes we have to remember, and hence why I talk about roots and wings. We have to remember, you know, past. There's a phrase from a philosopher called Jan Fishan Khan, who was started off as a Sikh warrior and then became a philosopher. And he says that the phrase that he uses is, "Those who don't remember the past are condemned to repeat it." And I think that's really, really important. So even if you take it out of equality, diversity and inclusion, just remember when you were training and you were a student nurse or midwife and you had no clue and you were just afraid of your own shadow. Yeah. It's really frightening to me how sometimes when we then become qualified, we forget what it was like to be that scared person.
Absolutely.
And the same thing here. You know, if we don't remember that for many Irish nurses and midwives, they spent time overseas and had to do that whole getting into a different culture, because it wasn't just about work, it was just about going to the shops and just how does the money work and just everything. But if we don't remember that, we are condemned to do to the next generation of nurses or people with different experience exactly what was done to us.
I must say, what I say to our students when they start with, I met the first year students last week, and I say to them, you know, when you're first on a ward, I remember being a student nurse and I'd never been in the doors of a hospital. And I said, you know, the fear you'll feel, the strangeness, that's how patients feel.
Yes.
Every day they walk, because they aren't used to going to hospital. No. So remember that feeling of fear, being out of place. And then remember, every single patient you come across will feel that way, because they're not used to their pajamas walking around a building, or, you know, and it's very important. You're quite right to not forget that piece and to and root your change in that, because actually then you'll get it right, won't you?
Absolutely. I remember I was speaking to some first year students, you know, when their first day, and they were all very excited but all very scared. And then that day before their first placement, and one of the students once said to me, she said, "But it's all right for you, Professor, you can do this." And I said, "Can I just tell you, when I did my first placement, in my first day on my first placement, I was in the care of the elderly ward, which way back in the 80s was called geriatrics. And I lasted an hour. After an hour, I had to go home, because I went to make the beds, because that's what, you know, hospital corners.
Absolutely, yeah.
I was be busy.
ETS.
And we did the work, and then I was asked to feed an elderly woman in bed, because she wasn't coming out of them. So I was feeding her. And unfortunately, while I was feeding her, she died. I gave her 3 spoons of porridge. On the 3rd spoon of porridge, she still had the 2nd spoon of porridge in her mouth. And I sat there, and I was 18 years old. And all the lectures about how to give news, how to walk calmly, were forgotten. I threw the porridge up in the air. I ran screaming down the ward, "She's dead, she's dead." And the matron at the time literally pulled me off the ward, dragged me away and sent me home. I was shaking like a leaf. And I said to the students, so when you see me now, confident and standing up, I remember being that nurse who lasted an hour on the first placement. So I said to them, no matter how bad your first day is, I promise you that will not be happening to you on the first day.
Yes,
Excellent.
Lovely reflection. With some lovely information in the chat box. So one of our attendees is saying, my personal contribution to inclusion is ensuring open communication within my areas of responsibility, recognizing that it's not always easy to feel part of the team and overcoming language barriers and cultures.
Yeah.
So I think that's a very nice
Absolutely.
reflection on what we've thought about. Fiona, I was thinking, Laura put a question to us. What can we do from where we are? What would you think directors of nursing and midwifery in Ireland can do from where we are today?
I think that's a huge question, because there's not just us, there's the
Yeah.
team, isn't there? So I think you have your sphere of influence.
Yeah.
So that's where my sort of sphere of influence is with my own staff and my managers. And there is something about, about kindness, I think is huge. I think if you're kind to people, you'll never go too far wrong. So I think if you see the level at the top of the hospital being kind to each other, it translates along the way. I mean, the years of bullying and all that kind of thing, and hopefully they're gone, but there are pockets of it there.
Yes.
So there is a thing of you have to live your values.
Yes.
So I try and live my values when I'm in work. I no matter, as you say, if people make a mistake, I'll catch them when they fall.
Yes.
And it's important they know that I will. And I think there can be, a fear of being, anyone who said makes a mistake, they need to just own it and own up to it, and we will catch them. We put systems around people. So, I think that's changed. Yeah, I think it's something we need to think about more. It's one of those things, I think you opened up a big discussion point for me this morning that I think we need to go away and talk about as IADNAM and other leadership, that you do own that. And yeah, we have to, people need to see you in action to see it.
Absolutely. And I think, we do what we see, don't we?
That's exactly it.
And also, I think the other part of that is we say and we state that is what we're trying to do. People also watch how we respond. So even if we are like that, we have to hold to account. We have to call things out. And it takes bravery to do that.
Yeah.
But, even though we're shaking, and we're human beings too, so we're also scared of these things. But if we are not seen to be acting, then who else is going to do it?
True. Yeah.
Absolutely.
Yeah.
And then what people learn very quickly is there's no point saying anything because nothing will happen.
Action is what's important.
Absolutely. Absolutely.
There's a lovely reflection from Linda in the chat box, and she says that universal language of a smile and eye contact is a very good starting point.
And again, I agree with Linda, and I think that also the interesting thing is meeting people where they are.
Yeah.
So the first question, some people sometimes say to me, what can I say? And I think we had some very good examples from some of the other speakers this morning too. But for me, I think the best way people approach me when they don't know is to say, hi, remember my name. If I have a name that they can't pronounce, it's absolutely okay to say, how do you pronounce your name?
Yep.
No one is ever insulted by saying, how do you pronounce the name? I've often seen people insulted saying, I can't pronounce that name, so I'm going to call you Jennifer.
Oh, don't I? Yes, yeah, that's not right.
Call me Jennifer, that's not
my name.
No,
Yeah.
this is how you pronounce my name. And it doesn't matter if you get it wrong, but the fact that you're making the effort, that's a really simple way that you demonstrate your commitment
Absolutely.
in that regard.
I think what you said as well is not being afraid to ask people their preferences. So then, you ask them, I don't understand, say from a religious perspective, there's so many religious, I don't understand what their perspective is and their beliefs are, and respecting that, but asking people.
Yes, one of the ways that I do that, for example, because I'm not supposed to be an expert on every religion and culture, and we all know, even if we have a shared religion, we all practice it differently. So the simplest thing I do with people, certainly when I'm working directly in practice, is I will explain to them the procedure or the process. This is what we usually do, and all I would ask is there anything in that process that I need to change or actually will be difficult for you? I don't need to know anything, because here's the expert in front of me, and they might say, no, everything is fine, or they'll say, well, actually, that's, would you mind doing this? But by asking that question, I give them permission and space to ask for something different.
And rather than their expertise as well, as you said.
Exactly.
They're the experts.
They are the expert in front of me.
And don't be afraid to ask.
Yes.
So excellent, really excellent.
I'm going to bring our conversation to a conclusion. I feel sad doing it.
I know, we could talk forever.
We could talk all afternoon, but an enormous big thank you to you, Laura, and to Fiona for sharing your wisdoms and joining our QPS TalkTimers in our lunchtime conversation. I'm going to close by going back to a quote that you shared this morning, which those who have a strong sense of love and belonging have the courage to be imperfect. And I just thought that was a lovely representation of our conversation. For our talk timers, I'm going to leave you all with a question to take away. What does belonging mean where you are, where you live and where you work? So a question to take away from our discussion today. What does belonging mean where you are? So I'm going to bring us then just to the advertisements. So in a good QI, we ask you and invite you to watch back on previous episodes, and using this QR code will take you to where this episode will be shortly. So over and out from the beautiful Loch Ree, and we're off back to the fabulous conversation at the conference. So thank you for joining us.
Thank you.
Bye.